We're taking you to South Australia now for a COVID update.
Greater Brisbane, and I understand that other states are not moving on lifting the restrictions with Greater Brisbane at the moment. There's no change from South Australia's perspective on that, but again, we are hopeful that we will be able to lift that restriction in the coming days, but we don't want to go 1 or 2 days too early and then have a catastrophe on our hands. South Australia has done extraordinarily well, and I thank the people of South Australia for the way that they've listened to the restrictions and they've noted what they need to do. Sometimes it's been hugely inconvenient, but by working together, we've been able to really create an environment in South Australia which is pretty much the envy of the rest of the world. I know that people are waiting for us to lift that restriction with Greater Brisbane. I know that it's been hugely inconvenient, and I know people were hoping that we could do that yesterday or today, but we're not in a position at the moment. There are still some worrying concerns there. There is still more testing to be done for people that have been released from the hotel quarantine situation and from some people who have been working in that hotel quarantine situation. So until Queensland get that information back, we're not going to be in a position to lift that restriction, but we're hopeful it will be done in the coming days. So I'm now going to pass over to Professor Nicola Spurrier, who will give us the daily COVID-19 update. Thank you very much.
Thank you and good afternoon. So whilst we have not got any community transmission in South Australia, which is good news, we do have another 2 cases in our medi-hotel, and they're 2 men in their 30s who recently returned from overseas, so they're not related. One is tested positive on day 1 and one is tested positive on day 5, which is very consistent with them acquiring that disease in the country of origin or during transit for the day 5. So that's not a concern, but it obviously really highlights the high incidence of the disease overseas, and people who have got relatives in the UK and in Europe will be very aware of the difficulties being faced by many countries in the Northern Hemisphere. So that gives us a total of 590 cases for South Australia, 12 active cases, and thank you very much to all the South Australians who got tested yesterday. There were over 5,000 tests done. We are really got a very high testing rate. I'm very pleased with that. Some of that is reflective of our requirement for people coming in from Greater Brisbane to be tested, and also from New South Wales. I'm very pleased that we can change the border arrangements with rural New South Wales. We will still require people to be tested coming in, and we'll be updating information. We're just reviewing people who are currently in quarantine who have come from rural New South Wales, and we'll make that a little clearer later this afternoon. But from midnight tonight, there will be no requirement. People in Wentworth and Broken Hill have already had that part of the state carved out and have not required quarantine coming into South Australia. So I am very happy to take questions, and the Deputy Commissioner is also here to take questions.
Those people who come from regional New South Wales from tomorrow, will they still have to be in isolation until their test results come back?
So the way I look at this is, and I'll say no to that, so directly answer that. So this is surveillance testing. This is testing people who do not have symptoms. Now, obviously, if you have symptoms, you need to be in isolation while you wait for your result, and that's for any South Australian or any traveller, and that just makes common sense because you've got symptoms and you might be passing it on to somebody else. Whereas somebody who's coming from a area that might be considered at slightly higher risk, we're doing surveillance testing, so that's testing a lot of people who don't have symptoms, and so I'm happy for those people not to require isolation.
Do you mind just clarifying, if someone was to travel from somewhere in Queensland like the Gold Coast then into a regional New South Wales town, does that mean that they no longer have to isolate if they are coming into this state because there are changes to the regional New South Wales rules?
Yeah, so if somebody is coming from regional, outside of Greater Brisbane, and then they're going through rural New South Wales, no, they wouldn't need to quarantine. It's only if they'd been to the Greater Brisbane area at this point in time, but they would require the testing.
Why today did you decide not to move forward with relaxing the Greater Brisbane restrictions, given that 24 hours were considered crucial?
Yeah, so we've had more information back, and as we have done throughout this pandemic, we are always sharing across states in terms of the information, and I get a depth of information from our counterparts. I understand that there's already been media done from Queensland, and they now have the genomics information back on another 2 travellers who happen to be in that same medi-hotel. So on the basis of that, we are now looking to see if there's been anybody released from that hotel that has travelled to our state, and all of those people need to go into quarantine. Unfortunately, it's very difficult. You've already done your international quarantine, but we're still trying to get to the bottom of what's happened in that particular hotel. It is very reminiscent of what happened here in South Australia with our peppers, when we had to unfortunately require people to be re-quarantined. So it's very, very precautionary, but we do know that this is one of these new variants of concern, and we know that it is more transmissible, and we don't want to take any chances. So we've got some work to do. My team is looking at doing that work at the moment, and we felt that on weighing these things up, it was much safer to continue as we are at the moment.
Welcome news there for South Australia today, with no community transmission, just 2 cases in returned overseas travellers. Now, in terms of borders, there have been some changes as of 1 minute past midnight tonight. South Australia is open to regional New South Wales. However, a hard border remains in place for Greater Sydney, Wollongong, Central Coast and the Blue Mountains. Greater Brisbane, there has been no changes from South Australia's perspective there, but the Premier has said he is hopeful he can lift that in the coming days.